Welcome to the radiology department. Hope you didn't have trouble finding us.
No, it's fine.
We're kind of tucked away. So just to let you know, I'm a really casual interviewer, so whatever you do, don't laugh. I'm just kidding. So, Terry, I found your resume. So why don't you just tell me a little bit about yourself?
Well, I'm a very hard worker, and I like to get things done right the first time. I enjoy working with people, and I'm very dedicated and punctual. And I know this is, I'm straight out of college, but I feel very prepared for the work environment.
Excellent. You know, getting things done the first time, that's always a good thing with radiology. Why did you choose radiology for your career path?
Ever since I broke my leg as a child and I saw the x-rays, I was just fascinated with taking pictures inside of the body, and the technology is interesting, and I know there's always going to be job opportunities in the medical field.
Absolutely, absolutely. That is definitely true. Technology is amazing these days. Do you have any plans to continue your education in radiology?
Yes, I would like to be dually educated in radiology and ultrasonic technology, or maybe even just working my way up in radiology and getting my education along the way. So.
Nice. Ultrasound is very interesting too. Is there a certain type of age group that you like to work with? We have like adults and kids and seniors, so.
No certain age groups. Anyone who needs help, I'm ready to help them. But however, I do like working with children. I've been around them a lot, so I'm comfortable with them.
So we'll keep that in mind if it need be. This can be, as a radiology tech, it can be very demanding at times. I mean, there's times when we get super busy and you have a patient on the table and you have one unit calling you for results of a test, and you have another doctor calling you demanding, the images be sent. So why don't you just tell me a little bit about how you would prioritize?
Well, the patient would always be my first priority. I would just have to develop a system to get the important tasks done between when I'm working with patients. And, when things get hectic or like fast-paced, I tend to get this like calm demeanor. I guess it's just my way of dealing with situations like that. So.
That is excellent, and the patient is always the first. The patient is our customer after all. I know you plan on continuing your education. However, we're kind of a small company and we try and work around your schedule as much as you can, but overtime is sometimes just unavoidable. And also being new, you may have to take the night shift and weekends a lot of times. So how do you feel about that?
I'm definitely okay with that. I know it's just part of having a job, and night shifts, weekends, just regular overtime, I'm okay with it.
Excellent, excellent. That's good to hear. You may at times have, after training or whatnot, we sometimes have to call in travelers because we get so busy. And in those cases, you may have to be like a stand-in supervisor position if nobody else is available. So how are you at your leadership skills?
Well, I was a summer camp counselor for 2 years in a row, so being in charge and responsible for a large group of children like that really made me feel like I can be a leader. And I feel like I gained certain skills like knowing how to lead someone without bossing them around, or just building a mutual trust with people.
I know exactly what you mean. I was a camp counselor right after high school, so I know exactly what you mean. Now, how long, if you were to be hired here, how long would you plan on staying with us?
Well, as long as I'm able. I like this area, and like I said earlier, I'm really looking for a career.
Excellent, excellent. Now, just one more question. Being part of the hospital, we do have times that we run into emergencies. Can you describe a time for me that you were in an emergency and how you handled it?
Well, at the summer camp I mentioned earlier, one of the kids, he started having a seizure, and I was scared. I was scared, but I was the only adult around, so I just kind of took charge of the situation and sent someone for help, and he made it to the hospital and he's okay, so I was just really glad I was there.
Yeah, I remember seeing my first seizure. I freaked out. So that's really, and especially with kids, that's great. I'm basically done. Do you have any questions for me though?
Yes. I was wondering, how long is the training period?
Well, depending on, initially it's a 3-month training period, and then depending on how well you do, we would reevaluate at 3 months, and then after about 5, 6 months, if, you know, if it doesn't work out, it doesn't work out. We'll know definitely by the time 5 or 6 months rolls around, but we try to do it initially for at least 3 months.
Okay. And what are your medical insurance benefits? And everything about?
I'm glad you asked. Our benefits are very comprehensive. Unlike other facilities, our benefits start from the day that you're hired, and you know that's including orientation and everything. So you would have about 30 days from your hire date and to get enrolled in what you would want. Our medical benefits are excellent. We also have comprehensive dental and vision benefits, and we also have tuition reimbursement, which is $2,500 a year. So and that's including school and everything. So most of our benefits, that's why a lot of people choose to stay with us, even though sometimes they don't really like it. Our benefits are great.
What about like opportunities for advancement or, you know, just promotions?
Well, I know that you're planning on continuing your career, and as you continue your career, of course, absolutely, you know, depending on the time that you're here, you will absolutely be looked at for that. And also, there are opportunities for advancement just inside the one level that, if you were hired, that you would be at ultrasound, or I'm sorry, radiology. That's what you're applying for, radiology. There's, you know, like supervisors, we have these supervisors, there's shift supervisors, so it all depends on how well you show your strengths and your weaknesses, but there are absolutely chances for advancement.
Okay, well, that's all.
Okay. Well, thank you very much.
Thank you.
And I will be talking to my supervisor, and you'll probably hear from us within probably the next week.
Thank you for your time.
You're welcome.